Welcome everyone to Revitalize Your Resolution, a 4-part journey to a healthier you. In our first installment, Move Your Body, we will explore the benefits of physical activities post-cancer. I'd like to introduce our speaker for today, which is Suzy Marshall. Suzy is an oncology nurse, a National Academy of Sports Medicine certified personal trainer, and a yogi who uses an integrative and holistic approach to wellness to achieve harmony in our minds and bodies. She incorporates various elements of movement to build on skill and strength. So at this time, I would like to turn the camera over to Suzy, and she will do our presentation today.
Hi, everyone. I'm so happy to be here today as we discuss the benefits of physical activity post-cancer treatment. If you don't mind, I'm going to read a little bit from my notes. So, as I mentioned, we'll discuss the physical activity post-cancer treatment involving chemotherapy, surgery, or radiation, or any combination of these. As we know, the effects of treatment can have complicated physical, cognitive, and spiritual or emotional outcomes, which in turn can affect a person's quality of life and sense of well-being, and also the ability, and we forget about this, to move safely through the world. So today I'd like to discuss why movement and exercise is at the top of the list as an intervention before, during, and post-cancer treatment. My goal as a cancer exercise trainer and a nurse is for individuals to move safely, but also to find joy in movement and reclaim your health and faith through healing movement. From a physiological perspective, there are numerous benefits of exercise that we can discuss. And these are really in no particular order, but they are all important. Number one, exercise helps to increase muscle mass and improve strength and balance, but it also improves bone health. So as we know, cancer treatment, particularly the chemical treatments, can result in muscle wasting and weakness. So resistance training and weight-bearing exercises can help preserve and increase muscle mass and improve strength. In particular, some hormone therapy can impact bone density, and this is also where weight-bearing exercises contribute to better bone health. Diet, of course, is important in this discussion as well, kind of, inherent in it, but separate from this discussion. Number two, exercise improves cardiovascular health. So certain cancer treatments, especially types of chemotherapy, may have negative effects on the heart and the vascular system. Engaging in aerobic exercise certainly can increase oxygen delivery to tissues and vasculature of the heart, and thereby improving cardiovascular health. This also reduces the risk of heart-related complications. Number three, exercise helps to reduce the fatigue associated with treatment and also helps to increase energy levels. And while it seems almost counterintuitive when we think about it, because a person may be so exhausted from the disease or the treatment process, engaging in some sort of gentle movement initially and consistently moving can result in these strength gains and reduction of fatigue. So it's incremental, it's bit by bit, nothing all at once. Number four, exercise is very helpful in weight management. And we understand from lots of research that that weight management is important to reduce the adipose tissue that attracts cancer in some cases. Physical activity is important before, during, and after treatment. Maintaining a healthy weight can positively treatment outcomes and overall well-being. Number 5, exercise helps to reduce the risk of other chronic diseases. So, for example, diabetes. Exercise helps the body to deal with its sensitivity to insulin, so it reduces the likelihood of diabetes occurring. Or we can think of atherosclerosis, or hardening of the arteries. Exercise reduces the amount of lipids that are, or fats that are in the bloodstream. So those are 2 examples of how you can actually reduce the fats in your system, or your sensitivity to sugars. Number 6, exercise can help improve sleep quality. This is a complex topic and involves much more than exercise, but exercise has certainly been shown to promote better sleep, just in terms of, again, circulation and blood, of the oxygen in the blood, but also the physical activity helps the body regulate hormones that might disturb sleep. Number 7, exercise can help reduce treatment-related side effects, such as nausea, constipation, and cognitive confusion. Also, exercise can help to reduce recovery times to certain treatments, whether short-term or long-term side effects of these treatments. It's been proven that moving will help with these side effects. From a psychological and emotional perspective, we see that improved blood circulation to the brain that occurs with exercise can really help combat stress, negativity, depression, anxiety, and cognitive confusion associated with the treatment process. So number 8, that's another reason. Number 9, improved quality of life. So as a person grows stronger and begins to feel better, feelings of independence start to grow as well. And these feelings build upon each other, as do these feelings of success. One thing that I've seen through my work, but also I've researched a lot, is that group exercise is instrumental. It almost works as a support group. It particularly is helpful in the survivorship process. It leads people to feel the feelings of belongingness and restores a feeling of normalcy because you're working with other people. And I think Carolina Breast Friends is particularly has fostered this idea, and it's a great resource for everyone because it helps have a place to feel like you belong and bond with other cancer survivors and friends. So exercise definitely can improve quality of life. And finally, number 10, although I'm sure there are many more reasons to exercise, moving can improve immune function. And what I mean by this is the lymphatic system. And, we probably hear many people when they have surgery have had lymph nodes removed. And lymph nodes are part of that lymphatic system, a vital part of the immune and circulatory system. The lymphatic system, not to get too technical, but it includes the bone marrow, the spleen, the thymus, lymph nodes, tonsils, and vessels and capillaries. So it plays a pivotal role in maintaining fluid balance and filtering harmful substances. It also produces antibodies that fight infection and disease. So here's the catch with the lymphatic system. It doesn't self-propel like the heart has its own electrical system. With the lymphatic system, movement is the most important factor that makes it work. So, it's really important that we move to help our lymphatic system help purify the body. So I wanted to give you some ideas when we talk about weight-bearing exercises. I think it's a little bit misleading because sometimes we feel like we have to go to the gym and we have to slug around a lot of weights in order to get benefits of weight bearing. So I wanted to give you some examples of other methods of weight bearing exercises so that you can incorporate them into your life and know that you're doing something beneficial. So we'll start with body weight exercises. Those are, lunges, squats, push-ups, those kinds of things. Cycling, riding a stationary bike. Dancing is a great example. It uses multiple muscle groups and definitely has cardiovascular benefits and also enhances balance. The elliptical trainer, well, we may not have one at home, but hopefully some of our gyms have them. And this is an important one, I think, because we underestimate gardening, digging, planting, lifting, as a weight-bearing exercise. And it's something so pleasurable for people, and can be really accessible, whether we have a garden or there's a community garden or we have planters, hiking or walking is terrific. So grab a buddy or more and go. Pilates, resistance band exercises, rowing, if you've seen the rowing machines, it's a full body workout. Swimming or water aerobics is a good option. And then tennis or pickleball. Usually, with all of the lateral movements that are involved, it can be a little bit jarring. So I would say, that's one of the weight-bearing exercises that would depend on, your level of, your exercise level and your tolerance post-treatment. And a more common one would be yoga. And, it can be relaxing yoga or weight-bearing exercise with poses. I would say, remember to first speak with your healthcare provider and then slowly progress your intensity and your duration of workouts. The most important thing is that you listen to your body with any of these and start at ground level, or what feels good to you, so that you're establishing a foundation. It's establishing a foundation without any pain or without any discomfort. And also, if it's okay with you, I'd like to go right into so post-treatment, especially surgical treatment, with any surgical procedure, it can be tough because musculature has been cut. Certainly there's a recovery time and it can be a little bit more difficult to regain range of motion and heal. But interestingly, and with doctor's permission, of course, depending on what type of surgery you've had, we can start with gentle stretching movements. They must be done in a slow and systematic fashion, and in a gentle progression. So I'd like to go through a few of them that are designed to help to improve your range of motion and certainly the function of your upper extremity, your shoulders and your arms. And finally, the stretching, even at a gentle level, is beneficial for the lymphatic system that we discussed. That is so important. It can help with lymphedema management, which is, I'm sure you've discussed with your practitioner before, and also the prevention of lymphedema. So I will move around a little bit. I think I might raise my chair, or you know what?
Stand?
Yeah, I can stand too. Okay. So the first one is a head and shoulder stretch, a neck and shoulder stretch, I'm sorry. And we can start by just tilting the head one way and then the other way. The only thing I'd like to mention to you is that your chin is not extended out. It's in line with your body. So if you have one finger to your chin and you're just gently letting your head bend sideways till you feel a stretch in the neck muscles, and then the other way. You can perform gentle circles of the head in two different directions. I know it's tough to see a little bit. And then roll the shoulders as much as you can, up, around, and down, and then reverse the circles of the shoulders. So each of these can be done for about 10 seconds, 5 to 10 seconds for the head tilt. And the circles, the same thing, taking them nice and slowly. Okay. The next one is, it's called scapular retraction. And you would sit or stand with your back straight. And with your arms at 90-degree angles, just take your elbows slightly behind your body, trying to engage the shoulder blades. So in other words, you'd like to feel like you're trying to grasp something between your shoulder blades. It's a gentle movement. And hold the retraction for about 10 seconds and then release. And then repeat it. Hold the retraction. And then release. And then maybe do that 3 to 5 times. The next one I'll demonstrate, it's really if you are, and I prefer that you lie on your back. It would require you to have a broom handle or a yardstick. But if you can pretend that I'm lying flat, all I'm doing is taking that broom handle in my hands, I'm sorry, and then raising it to shoulder height. And then lowering it down. Thank you. So if one arm is affected, or if the surgery has been done on this side, then you'd really rely on this arm to help guide that arm up. And initially you'd come to shoulder height, and remember I'm lying down. because that would be a little bit more supportive of the body. And then eventually you would take it a little higher than shoulder height. And then perhaps a little farther up and lower down. It would be important, even though you're helping with your range of motion, not to force anything, to keep the movement as gentle and low impact as you can on the affected side. The point is just to move and to get the body accustomed to that movement. Okay, let's see. So this is a little bit more progressive. This is called elbow winging. And again, you'll have one side perhaps or both sides that have been impacted. Gently interlace your fingers behind your head and press your elbows back slightly. It's a very minimal move. And then you can close your elbows and open your elbows. And I would repeat that maybe 3 to 5 times. Again, not forcing, and if it does feel uncomfortable, I would go back to some of the earlier exercises that we discussed. This is one of my favorite movements, just because I like to do this. I probably do this every day for posture. And it is a wall angel. It can be a floor angel. It's usually a snow angel for kids, but it's lying on your back or sitting against a wall and bringing your arms up overhead and then pulling them down. And then up overhead and pulling them down. And as I mentioned, this is a great postural exercise. But just to let you know, if your arms are not all the way by your sides, that's okay. It's a progression. So maybe your arms are not fully touching the wall initially, and that's okay. Work within the range that you have. And if they're just in front of you, work within that range first. Okay. Chest stretch is our next exercise. While you're standing with your feet apart, you'll take your hands behind your hip line, just behind your hip. So that your shoulders are again in that position where they're open and you feel a gentle stretch across the front of the body. If you are further along in your recovery, you could interlace your fingers behind your back. And finally, and this too is a little bit more of an advanced stretch for farther along in your recovery process, would be a stretch against a wall. So if you are standing against the wall, your arm would be at a right angle. Is this tough to see? And my right side is close to the wall. And then I'm just turning away from the wall with my left side. So again, I'm feeling a gentle stretch of that affected side. I hope that's clear. And you can do that on both sides as well. So there are about 7 stretches that we have. These will go into the library at Carolina Breast Friends and they'll be available to you. If you have any questions about them, we can surely field your questions or show you how to do them in person, which I think would be really beneficial. And once you become a little bit more familiar with these and are able to progress through those, we have some ground level, very helpful strengthening exercises to do that follow the stretching. So that's up and coming for you as a resource. So we just wanted to make sure that you know that. Remember to start slowly and progress gradually. And if you experience pain or discomfort, or you have any specific post-treatment considerations, make sure you consult with your healthcare provider, or connect with someone. Okay, that is what we have for you during this segment, and here is Ashley.
So I just wanted to come back on and say thank you so much for joining us today for the first of a 4-part series, Journey to a Healthier You. At this time, I will stop recording and we can do a live Q&A with Suzy.